Good morning. I'm going to give a quick correction. I'm Katie Brooks, but Katie Kramer is also fantastic. Not a problem at all. How's everybody doing today? Good. Welcome to Kansas City. Thank you so much for taking the time to come out. We have some very riveting, exciting, fantastic, and intriguing topics to go over the next few days with you. At any point during the presentations, please, I would really like to encourage you to use Slido to enter your questions. It's a great tool, and we take all of the questions that are entered very seriously. We do our very best to answer every single topic, so please utilize that tool as much as you guys can to reach out to us to make sure that you're getting the information that you need. So, thank you again. Like I said, I'm Katie Brooks. I am the IRF QRP coordinator for CMS, and again, thank you for coming. We're going to go ahead and get started here. All right, so as you all know, CMS is riddled with acronyms. We like to keep things nice and confusing for you. I know that Bridget mentioned that you should all have an acronyms list within your participant folder. Please feel free to use that throughout the day. We are, to keep things moving, we're going to be using our acronyms frequently throughout the presentation, so please keep that list handy, pull it out, set it right in front of you. That way you always have it to refer to when we're going through a specific topic and you're like, I don't remember what that specific phrase stands for. You can just refer to it easily. Here's a couple of the acronyms I'm going to be using in this presentation. I'm not going to go through them because they are on your sheet. A few more acronyms for you. All right, so my goals for this presentation is to make sure that all of you understand what the IRF QRP is. IRF QRP, if you're not aware, stands for the Inpatient Rehab Facility Quality Reporting Program. I'm going to summarize high level the changes to the IRF-PAI version 3.0 that's coming up to be effective this October. And that's basically just the new assessment tool that you'll be using to assess all of your patients. And then finally, I'm going to also do a high-level overview of the changes to the new IRF-PAI manual that accompanies that IRF-PAI version 3.0. All right, so let's start off with our overview of the IRF QRP and make sure everybody understands, why we're here and what the IRF QRP is all about. The IRF QRP was started by the Affordable Care Act in 2010, which amended the Social Security Act and required the Secretary to establish quality reporting requirements for all inpatient rehab facilities. Starting in fiscal year 2014 and every year thereafter, we required inpatient rehab facilities to submit quality data, and any facilities not complying with that requirement were subject to a 2% penalty to their annual increase factor, also known as an annual payment update. Additionally, in 2014, we had the IMPACT Act, which required the submission of standardized patient assessment data by LTACs, or long-term care hospitals, skilled nursing facilities, or SNFs, and then also IRFs and home health agencies. The Meaningful Measures Initiative is intended to provide a framework for quality measurement and improvement work at CMS. While this framework serves to focus on those core issues that are most vital to providing high-quality care and improving patient outcomes, it also takes into account opportunities to reduce paperwork and reporting burden on providers associated with quality measurement. To that end, we have begun assessing our quality program's measures in accordance with the Meaningful Measures framework. If you need any additional information about the Meaningful Measures framework, there's a lot of information provided in the link here in the presentation, and you should all have access to that presentation. This Meaningful Measures framework involves assessing only those core issues that are the most critical to providing high-quality care and improving individual outcomes. The Meaningful Measures area serve as the connectors between CMS goals under development and individual measure initiatives that demonstrate how high-quality outcomes for our Medicare, Medicaid, and CHIP beneficiaries are being achieved. They are concrete quality topics which reflect core issues that are most vital to high-quality care and better patient outcomes. There's examples of the meaningful measure areas. Those include healthcare-associated infections, prevention and treatment of opioid and substance abuse disorders. And each of these meaningful measure areas help to make the connection to specific CMS goals, such as empower patients and doctors to make decisions about their health care, or support initiative approaches to improve quality, safety, accessibility, and affordability through depicting core issues that are broader than a given individual measure. So, in summary, the meaningful measures basically just drives how we determine the measures that we ask you as IRF providers to report. Quality data for the IRF QRP is collected and submitted using 3 different methods. We have our IRF-PAI, where we take the data that you submit off of assessments that you collect on our patients. We have our CDC NHSN measures. And then finally, we have our fee-for-service claims-based measures. We have a total of 8 measures from the IRF-PAI. 4 of them are listed here. We have our falls with major injury measure, our basically care plan, ensuring that your patient has a care plan associated. We have our functional outcome measure, which is where we assess a change in self-care for medical rehab patients, as well as a change in mobility score for medical rehabilitation patients. We have our discharge self-care score for rehab patients and our discharge mobility score for rehab patients measure. And then our last 2, we have our drug regimen review and then our changes in skin integrity. We're going to be going very in-depth with the drug regimen review when we review section N today, and then also in the skin integrity measure when we review our section M today. We have 3 measures that are currently being collected through the CDC NHSN system. NHSN stands for National Healthcare Safety Network. It's a fabulous system. It's very easy to use, very user-friendly. I know that everybody loves the NHSN system. But I do want to kind of stress the importance of those NHSN measures. Those are reported separately from the IRF-PAI data, and it's very critical that you guys are going in and reporting those infection rates. That not only helps us with our quality reporting requirements, but it does also help the CDC in kind of keeping track on metrics nationwide. So that NHSN system is very important. We do have several resources, and the CDC is also a great tool to reach out to if you have any questions about submitting your data. I know that I joked about it being user-friendly, but they are available to help you, so just keep that in mind. Our measures there, we have our CAUTI measure, we have our healthcare influenza vaccination measure, and then we also have our CDI, or our Clostridium difficile infection measure. Then we have 4 claims-based measures. These measures you don't have to do any extra reporting for. There's no extra steps. We pull this data off of the claims that you report to CMS. So we have our Medicare spending per beneficiary measure, we have our discharge to community measure, and then we have 2 potentially preventable readmission measures. And just as an FYI, the data being publicly reported for the for the potentially preventable readmission measures, as of right now, you should all be aware that CMS is suppressing the public reporting of that data until further notice. For the potentially preventable readmission measures, the public reporting of that, CMS is currently suppressing the data on Compare. So when you guys log on to IRF Compare, you're just going to see that that data is not being suppressed, or is not being displayed, and that's being suppressed until further notice. So if you guys have any questions about that, just please feel free to use Slido, let me know. We did remove a few measures from the IRF QRP with the fiscal year 2019 rule. We removed our initial pressure ulcers measure. That was replaced with the changes in skin integrity measure. We removed our patient influenza vaccine measure. We also reviewed our MRSA measure. We removed our MRSA measure, and then we removed our all-cause unplanned readmission measure for 30 days post-discharge. All right, so just a high-level review of, again, what were our goals for training in the IRF QRP. We want to really focus on collecting accurate quality data. So when you guys are going through and you're documenting your IRF-PAI assessments on your patients, we want you to focus on coding correctly for that patient. And just know that the data that you code on your IRF-PAI assessments is not just used for your quality data reporting and your compliance for the IRF QRP, but it's also used to calculate the process or the outcome. It's identified for inclusion and exclusion criteria, and it's also used for risk adjustment to your outcome measures on admission. So it's really important that you're accurately collecting data on your patients. All right, so let's go over a few high-level changes to the IRF-PAI version 3.0. As a reminder, your IRF-PAI 3.0 goes into effect October 1st, 2019, so just a few months from now. It's available on our cms.gov IRF-PAI website. If any of you don't have the link to that, the links are available in the presentation. You can access them at any point in time. So a couple of changes that you're going to notice with our IRF-PAI version 3.0. We deleted our functional modifiers, we deleted the Fem Instrument, and then we deleted section O, which was special treatments, procedures, and programs. And that also involved deleting the O0250A through O0250C items from the IRF-PAI. All of this was in response to the fiscal year 2019 rule. Again, we took out our functional modifiers. Here's just a couple of screenshots of those items that we pulled from the IRF-PAI this year. So this is due to the IRF Prospective Payment System, or PPS revisions. The FEM items and associated functional modifiers are no longer required. And one thing that I just like to stress with that, although we say they're no longer required, that does not mean that you need to stop collecting data on them. We just no longer require you to submit them to CMS. Again, removal of the Fem Instrument from the IRF-PAI version 3.0. We no longer require them. And then due to the removal of that patient influenza measure, we also removed the patient influenza vaccine items. And then again, section O was removed due to the removal of O0250. All right, a couple of updates to the IRF-PAI manual. So we received several comments through trainings such as these, as well as help desk questions requesting us to make the IRF-PAI manual easier for providers to navigate and just to use overall. So we heard you, we took that request very seriously. One of the things that we did up front was we renamed it the IRF-PAI manual just to kind of streamline things, make it very clear that this is the manual that is your guidance or your guideline to the IRF-PAI. So you're going to notice that this year we have a brand new name, IRF-PAI manual. Very similar manual to what it was previously, but just know we've renamed it to kind of streamline the name, make it easier to understand what it's for. We've made the manual more user-friendly, and it has been significantly updated. So everything's nice, fresh, and clean in there. And I am not sure if anybody noticed, but we did post the IRF-PAI manual last week, so that is now available to everybody. And that's the manual that applies to IRF-PAI version 3.0. So some of our key structural changes. The IRF QRP and the IRF PPS sections were combined. So previously we kind of had two separate sections. The structure was long and drawn out, and it wasn't really streamlined, wasn't very clear. We've combined the sections to make everything more user-friendly and easier to use. The overall format is also aligned with other post-acute care quality reporting programs such as LTAC and SNF. We have 4 chapters with IRF-PAI specific coding guidance, and we have 5 appendices with additional provider resources. So a lot of very good information in there, especially for new employees learning how to use the IRF-PAI for the first time. Our new IRF-PAI manual is perfect reference for them. We also have an administrative information and quality indicators section. Those have been moved to Chapter 2, IRF-PAI item by item coding instructions. And one thing that I wanted to note is that administrative items refers to items that are included under identification information, payer information, medical information, discharge information, and therapy information. I do want to note the change in naming conventions from sections to chapters. So that is something that is new with the IRF-PAI manual version 3.0. Our Chapter 1 includes an introduction to the IRF-PAI training manual. Chapter 2 includes item-by-item IRF-PAI coding instructions. Chapter 3 includes clarification of terminology, something that's always useful when working with CMS. And then Chapter 4 includes CMS data flow coding and the CMS patient data system. All right, we also have the 5 appendices that we mentioned. We have our impairment group codes and ICD-10 CM codes. We have our actual copy of the IRF-PAI version 3.0. We have our helpful IRF resources, our CDC submission guidance page. That's for when you're struggling to submit your NHSN data. We went ahead and included that submission guidance right in the IRF-PAI manual for you. So it's right there, very convenient, easy to get to. And then finally, we have our patient privacy and privacy rights under the IRF PPS. We have item-by-item coding instructions that have been updated to reflect the removal of the FEM and associated function modifiers. We removed the patient influenza vaccination items. We changed the definition to major surgery, and that's item J2000. And that basically just removed the general anesthesia as criteria for major surgery. So that definition has been updated across post-acute care quality reporting programs. We updated the clarification of terminology to reflect the removal of the FIN items, and we also added new terminology based on frequently asked questions coming into our help desks. All right. So at this time, if you guys have any questions, I would like to encourage you to go ahead and enter them into Slido. I'm about at time for my presentation, so I think that Slido is probably the most efficient way to ask questions there. But again, I do want to thank you so much for taking the time to come out to Kansas City today to participate in our training, and for those of you that are participating online, we genuinely appreciate you taking the time to call into our webinar for today. So thank you so much. At this point, I'm going to pass it over to my colleague, Terry.